Dr. Lee, we appreciate you joining us. Listen, the CDC's new guidance, the shortened isolation period, it's drawing a lot of criticism. I'm curious where you stand on the CDC's guidance. Will it help or hurt our fight against COVID?
Yeah, thanks for having me, Seema. So the concern is that while some people may not be infectious beyond 5 days, there's actually some uncertainty. There have been studies that have shown that some people may be infectious beyond that 10 days. There are even case studies of people being infectious beyond that. So while this may fit many cases, the concern is that this might be a bit short-sighted and allowing people to go return to work and mix while they potentially may be still infectious is of concern. Plus, having people wear face masks for 5 days afterwards, there's questions, will they wear that properly? Will they really prevent themselves from spreading the virus?
Yeah.
So there's some concern about that.
Yeah, the hope is that this new guidance will alleviate some of the staffing shortages. But to your point, a lot of it's now at the discretion of the person who is infected with COVID. So overall, do you think this actually leads to even higher cases? Will this backfire and lead to even more hospitalizations?
That's the concern. So the concern is it could lead to more hospitalizations. So people may be transmitting the virus at work. And also the intent is to alleviate staffing shortages in many cases with healthcare personnel. But healthcare personnel are also exhausted right now and tired. So if you're sending people back, trying to send people back too quickly, that certainly may backfire.
What's your read on why more children who are testing positive for COVID are getting hospitalized? Is it simply because they're unvaccinated, or is it something else?
Yeah, that's one of the big issues that when you look at the percentage of people who've been vaccinated, certainly children, especially between 5 years and 11 years, are lagging because naturally the authorization came later and then for adults. Plus, there's still a significant vaccine hesitancy among certain parents, so we don't have children covered as much. Plus, this virus seems to be more transmissible and more contagious. So it is spreading quicker and faster than previous variants. And we know that children, in many cases, especially when they go to school, can be super spreaders because they contact a lot of different people, they interact with each other, and they probably aren't as good at social distancing and maintaining precautions.
Biggest piece of advice for those who are worried about this new guidance and trying to figure out how to conduct their daily lives?
Well, the guidance is simply guidance, so it's not strictly enforceable in every location and for every employer. So I would suggest being more conservative because you have to keep in mind that it only takes 1 or 2 infectious cases to really cause an outbreak. So if you're an employer, you want to be careful because you have to look at the longer run, the bigger picture. If you suffer an outbreak, then that can actually set things back rather than move things forward. So I would be more conservative about isolation and quarantine guidelines. Again, these are guidances. They're not strictly enforceable. So you want to be careful about your own situation.